The following program is sponsored by Healthcare Associates of Irving and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.
And hello, welcome to Ask the Doctor. I'm your host, Mike Berger. We're joined today by Dr. Charles Powell of Healthcare Associates of Irving, and we'll be talking about Medicare, healthcare, and wellness for folks over 55 years of age and older. We'd like to remind you to please join in. Just call the number that you see on your screen. That's 1-877-563-0099, or email your questions to cpowell@healthcareassociates.com. Let's start out by welcoming Dr. Powell and learning a little bit about Healthcare Associates.
Well, thanks for having me.
Sure.
Healthcare Associates of Irving is my practice that's somewhat in between Dallas and Fort Worth. It is a wonderful facility that allows a multifaceted approach to patients. We are basically redesigning the practice every day to make sure we have healthcare available to our clients as they approach Medicare years and further into that.
Well, we have a lot of great information for you today, and we're going to start out with a question from Susie in Little Elm. She asks, what emergency health problems are you seeing in our Medicare population?
You know, within Medicare, there have been these health problems that are there for some time. It's just that we're finally starting to recognize them before they become an endpoint that costs the system so much money. For example, Medicare Advantage plans that are there now are basically insurance plans that Medicare pays them to take care of their population. What I love about the Medicare Advantage plans is they really focus on preventative medicine and preventive maintenance for our clients and our patients. With that said, we may be identifying more type 2 diabetes, high blood pressure, high cholesterol and whatnot, but the goal of this is to help prevent the endpoint of the heart attack or the stroke or other life-threatening urgency that runs up health costs so much.
So basically what's happening is if you have one of these programs, they kind of keep on your back and say, hey, you need to go have this checkup, you need to have this done, so on and so forth, so you can catch the problem sooner and address it and take care of it.
Well, what's nice about the Medicare Advantage programs is they've really gotten to something that Medicare was not originally designed for. When Medicare was signed into law in 1965, it was there more to deliver care to the endpoints of health care for our population over age 65, and it's grown so much through the years as to what it's really there for. The Medicare Advantage plans take a hold of very valuable research that knows that if we provide preventative health care, we can lower the expenses to the system over time and also bring about a patient that hopefully has less of a chance of disability and a longer, happier life.
Excellent. The phone lines are open. Again, we'd like to remind you to call with your questions. Cindy from Dallas has a question. Cindy, go ahead.
Do you think more doctors will stop taking Medicare in the future?
Oh gosh, see, that's
important question.
That's an important question. It could probably just take up a whole show in itself. You know, all the time we're hearing about more and more providers that are getting out of Medicare. My patients are calling me saying, I need to find a new orthopedic doctor, I need to find a new rheumatologist because mine stopped taking Medicare. We see it all the time, and it is disappointing because a lot of providers are scared about the future and what's going to be happening with Medicare, where we're basically being asked to do more with less. Now, I think, again, this is where the Medicare Advantage programs step in, and this is where Healthcare Associates of Irving, my practice, steps in to make sure that we continue taking these products and we deliver an expert level of care for both now and for years to come for these individuals. We pick up so many people in our new practice every day that come in as new patients because they've been left by another provider, and we're there for them and we'll continue to be there for them.
All right, here's another question. It's an email question from Mike in Addison. He says, do you foresee us getting healthier as a population, especially in the Medicare population? Now, you mentioned Medicare population. Of course, the baby boomer group is now the largest in the country, and they're all pretty much over 65.
Absolutely, and as we're seeing that population move into the Medicare years, we are identifying more disease states, but at the same time, we're taking care of them now before it becomes a problem down the road. So the actual design of the programs are to create a healthier Medicare population, but that's going to take a concerted effort, and it's a team approach both from me as the doctor, from the patient, and believe it or not, the insurance company plays a vital role in this right now for several different reasons. They're there to help promote health, both for the patient and for the relationship between the doctor and the patient.
Is there help for patients? We've all lived a lifestyle that could have been a lot better, let's face it.
Yeah.
Are there parts of this program that will help those people get back on track, so to speak?
Absolutely. You know, when you look at the Medicare Advantage plans and what they're doing right now, they at times will send doctors and nurses out to the person's house to try to get them really involved with their own health care, trying to identify problems and get them into the appropriate care that they need before it becomes a major problem.
Excellent. We're going to take a short break. We'll be right back again. Don't forget to call with your questions, 1-877-563-0099, or email us at cpowell@healthcareassociates.com. We'll be right back.